So with that, let's jump into the charity roundtable. This is important to me. I spend a lot of my time when I'm not at work helping to raise money for various charities. I talked to Kurt. I want to compliment you, Kurt. Kurt was all in on this proposal. When I said I want to do this as our team call, there's a lot of stress going on. A lot of people are worried about a lot of things. And the best thing to do when you're worried or stressed is help others. Because when you help others, you have a greater appreciation and gratitude. And that was the word Kurt and I talked about last week when planning this. Gratitude for what we have and sharing that. So when we do that, I think it lessens our stress level. So we've all done really well in our careers. It's time to do some good here. So I want to thank JP, Santosh, Richard, and Kurt for all sort of giving me the backing to do this and sharing your slides with me on the charities that you're passionate about. So I was doing a little bit of research on this and found a few things here. I think that first quote of Mother Teresa is really important, and it's not how much we give, it's how much love we put into the giving that we do. And that's the thing, is we want to have gratitude, we want to care for other people. We have been very blessed, and we need to share that, I think, and make a life for ourselves by building a community around us. So that was the genesis of this, and it's a privilege that we all have, as Rockefeller said, to be able to be blessed, and let's share that. So what I want to do now is go into, I'm going to do 5 minutes on each of these slides, and talk about each of our charities, and kind of position that charity with you, so you get to see sort of why this matters. So you can see I'm wearing my shirt. I'm a Real Men Who Wear Pink. Real Men Wear Pink is one of the American Cancer Society's fundraisers. It's been around for about 15 years, and I've represented many times of this. And my current wife now worked for the American Cancer Society for 18 years. It had a huge effect on my family. Those of you who know, I lost my first wife 5 years ago to melanoma. So it's mattered a lot to me. I've learned through the last 5 years that early detection is the key, and getting word out there about the cancers that are preventable with early detection. So American Cancer Society is leading cancer fighting organization, and their vision of ending cancer as we know it. Now that sounds a very aggressive goal, end cancer as we know it, but what they mean by that is, with early detection, with all the research that's being done, the excellent medications, the excellent treatment, all of the patient support that's being done by American Cancer Society, we're going to end cancer as we know it now. A lot of people now, when they hear the word cancer, they believe that it is a death sentence. And in fact, the American Cancer Society is working to say, if it's caught early enough, you can have a very positive outcome. You can have a very full life because of the treatment plans that are now being developed and available and researched by funding and research that's done by the American Cancer Society. So it's not that we're ever going to say cancer is going to be over. There's always going to be cancers popping up. But if you catch it early, we have excellent treatment, you can have an excellent outcome. So it is a 4-star charity rating out of 4, which means they're rated very high in terms of their giving. In 2022, 81% of the resources were invested in patient support, discovery, and advocacy. Very important efforts that they support people once they get cancer, to get them to treatments, to get them rides to treatments, to get their families housing when they're in treatment, etc. They did $354 million in patient support, $166 million in research. And I was actually privileged to go and hear one of the researchers talk about the work that's being done. And I left that luncheon thinking, oh my God, we're going to beat cancer. I was so excited about the opportunity that we have before us to be able to end cancer as we know it, and I'm all for it. So my ask of you today is to do your annual screenings. I want everybody on this call to go refer to that link. I'm going to paste all the links at the end, don't worry. I want you to go to that link. I want you to read it. If you're age 45, then you need to get a colonoscopy. If you're a female, you need to have a mammogram. So I want to encourage you to follow those guidelines, because again, the key to the whole entire thing is early detection. If something is not right, you need to have it looked at and get it looked at early, and you can be able to have a great outcome. There's a link here on the page for volunteers. If you want to volunteer, there's events in every town in the U.S. and even around the world. There's a Strides, which is making strides against breast cancer. That's going to be in the month of October. There's relays that are happening all over the place to raise money for fighting cancer. And then there's a lot of towns, larger towns, have a Hope Gala, which is where it's a night where a lot of people dress up and come together to raise a lot of money. Our Hope Gala in Knoxville was last Friday night. In a small little town of Knoxville, Tennessee, Last year we raised $1.1 million. This year we raised $847,000 this year on Friday to fight cancer in my tiny little hometown. So these things are happening. They need volunteers, and I want to encourage you all, if you're interested in fighting the fight, click that link and volunteer and get involved. And then finally, there's the donate link at the bottom. If you'd like to donate money to the American Cancer Society, you can do it right there. Although if you use your VMware Foundation link for the next, 35 days or something, VMware will match that. So they'll double your donation. So while these links are important, you can also go through the foundation. I think for everybody's charity today, the foundation is the way to give, because the foundation will double your gift, will match it. And in some cases, I think they may triple it. I think there might be a double match. So it might be tripled. So we'll look at that as we get forward. So that's it for the American Cancer Society. Anybody have any questions about ACS or about cancer in general? I'm happy to answer those now.
So Brian, one of the things which I would like to comment is, like from personal experience, I've seen people who are perfectly healthy, right? And this has actually happened in my friend group. People who have actually gone through regular screening, like one of my friends, we were just sitting at a table and we were just chatting. And one of our friends is a gastroenterologist. He just said, one day or the other, you are going to come to me. And lo and behold, right in a setting of like around 6 or 7 people, 3 of them raised hand. Oh, you know what? I have not got it done. And we were all over 50. Right.
Mm-hmm.
Believe it or not, one guy, had he not gone for this colonoscopy, it would have been a very different result in 6 months. It just happened while we were just sitting at a dinner table. We were just chatting and all that stuff. So, and it helped saved our friend. And not only that, it's always important to actually get it done. I get it done every 5 years, right? Because and it helps me because there are some polyps, and if we don't take care of it now, it turns cancerous. So, guys, I cannot stress the importance of like early screening. My wife goes through hers every certain number of years. I go through my stuff. The earlier you catch it, the better it is. And believe me, I know so many of my wife's like all of her friends, none of them have had an adverse result when it came to breast cancer. Everybody has been cured. So
because of early detection. Because of early detection.
Yes. So please take care of yourself. And awareness is again one of the things. Understanding what those signs are, right? Understanding, hey, I have to go to the doctor. Save some time for yourself. No health, no wealth.
Exactly. Thank you, Kurt, for that. I appreciate that. And I want to pause here for a moment. We all know our dear friend that we love, Joe, who we lost to this disease. And Joe's was not caught early, right? And so we love you, Joe. And so get screened. My hope today is that one of you goes and that many of you go and get screened, and that you take care of it when it's able to, as Kurt said, be taken care of. So thank you. My second charity is the Children's Healthcare of Atlanta. We all have children's hospitals in the cities that we're in. This is one that I care passionately about. My oldest son had 7 open heart surgeries from this hospital between 1996 and 2010. Miraculously, he is thriving today. He's an engineer. He lives in Knoxville, about 5 miles away from me. They saved my son's life multiple times. There were times when we didn't know if he was going to make it. They saved his life, Children's Cardiology of Atlanta. They're listed as one of the best children's hospitals in the U.S. for cancer and one of the best hospitals for cardiology work. They provide best emergency or critical care to children throughout the southeastern United States. The Cancer and Blood Disorder Center is a national leader in pediatric cancer, which is very hard because children don't have the screenings that adults have. The guidelines are different for children. So this is even harder. But Children's Cardiology is ranked number 12 in the U.S. They have 2,100 physicians and lots and lots of volunteer hours that are done there. So my ask of you today is to volunteer at a local children's hospital. Now, I don't think Bob Goldstein is with us today. Bob has a Batmobile, an actual full-size Batmobile. And my first time I met Bob, he told me about how he likes to dress up as Batman, middle-aged Batman, and drive the Batmobile to a children's hospital and take the children for rides and let the children climb around in the car. That is an unbelievable charity that Bob does, and I want to tip my hat to Bob for doing that. But donate your time to a children's hospital. They have lots of needs, whether it be a candy striper. When I was in the hospital with my son in Atlanta, there's a lot of children in the hospital whose parents are both working, or who only have one parent who has to go to work. Those children have no one to play with during the day or during the evenings. They have no one to visit them. It's heartbreaking. It's heartbreaking to see these children in the hospital who have no one there. That you go past, my child's room, there's balloons and flowers and toys, and you go past their child's room, and there's just a child in a bed. Ask to get involved in the hospital. Go just sit in the room, talk, watch TV with the child, watch sports, put a game on. These children need socialization. They need the love and support that you can give. Just visiting with them, sitting in the room. So if you want to give to My Children's Hospital in Atlanta, you can click the link there. Obviously, you have a local children's hospital. Seattle Children's is actually one of the best in the country, Kurt. You guys have an amazing children's hospital. I've known those folks for many, many years. So my encouragement here is to donate to a children's hospital. You can't go wrong in doing that. And again, tip of the hat to Bob. So this is a little difficult. Many of you know I lost my wife to melanoma 5 years ago. There were 4 things that my wife cared passionately about. One was childhood education and early reading programs. And book ownership is at an all-time low. And if children learn how to read at a very young age, they have incredibly better, successful outcomes of their life, of their quality of life, of their job, of their family, of their wealth, or their way to make a living. So my wife's passion was early childhood reading. Her other passions were healthcare innovation, justice reform, and the environment, and caring about our environment. So when my wife passed away, my 3 children and I formed a foundation. We went through the process to become a 501(c) U.S. nonprofit. So we did all the paperwork with the IRS. We did all the paperwork with the state. We're a completely valid 501(c)(3). We give 100% of our money. Every dollar we raise, we give 100% of it to these programs of justice reform, childhood education, healthcare innovation, and the environment. And we have a website there, larosefoundation.org, and we've raised a lot of money. We've given a lot of money away, and this is the best way that I could honor my wife for the work that she did when she was here, and the best way that my children could honor their mother. And so the National Literacy Trust says 9.4% of children do not have a book in their home. Could you imagine? That's 1 out of 10 kids that do not have a book in their home. Now, we live in Appalachia, which is a very poor region of the country. Here, a lot of disadvantaged families that don't have a book. And my program, my wife's program, we buy books. We go into the book fairs at the schools, and we give the librarian, here's a check. When we're having a book fair, I want you to select the students that couldn't afford to buy a book, and you send us the bill. We're going to buy the book for that child, and that child's going to go home with a book, so they can have a book. And some of these books, you wouldn't believe them. They read the same book 100 times because it's all they have. They have no video games. They have no phones. They have nothing. They have this one book, and they read Charlie and the Chocolate Factory 100 times. They know the story by heart, but they learn to read by reading that book. It's an incredibly powerful opportunity. You see the quote there from the governor of Illinois. Studies have proven that early childhood education returns $12 for every dollar you invest, because you have an educated society, and that's an amazing statistic. The number one way you can address the long-term challenges of poverty is education, to invest in early childhood education. And so that's the point of what we try to do. And I think, again, this is the best way to honor my wife, because these are the 4 things that she was passionate about during her time here. And so she's not able to carry on her work, but the children and I are going to continue to do that. So, and we're listed in the Charity Navigator as well, and we're listed in the VMware Foundation. So I haven't pushed it, but if you haven't donated, you can go through the VMware Foundation and donate to my family foundation, and 100% of that money will go to buy books for kids. So I'll get off of that before I start losing it. So JP, again, had a last-minute meeting with a DXC executive. JP dated someone over 20 years ago who ended up having multiple sclerosis. This is a crippling disease, an absolutely crippling disease that doesn't affect the mind but affects the body over time. So you watch as your body struggles to. Rich can speak to this. Rich, would you love to speak to the MS slide? Please unmute and take over. I would love that.
Yeah, hey guys. So MS has affected my family. My sister-in-law's gotten MS, and I had a number of previous employees that I worked with at Dimension Data who had MS, and Dimension Data is a massive advocate for the MS Society. So about 12 years ago, I started on a charter supporting the MS Society through my now partner, who was my employer at the time, and started picking up cycling. And over that course of 14 to 16 months of that, we've ended up raising $150,000 in the first year for the charity across the organization. But I've also lost 95 pounds in the process of doing so. So getting healthy at the same time. So getting out there and cycling. This charity, it's about 75% of what they do goes directly to the MS patient to support them going in through treatments. Treatments on MS and discovery of MS is extremely difficult. Having a true diagnosis is almost nearly impossible. It's diagnosis by neurology and what they feel, that sort of nervous systems, et cetera, that you get diagnosed with MS, and sometimes progressive. And unfortunately, with my sister-in-law, it's progressive. So she's lost movement and ability to move her arms and legs over a 5-year period, having problems swallowing. So it does affect a lot of people. It's one of these diseases that everyone kind of hears the name of it, but you don't really think it's going to affect you in some way or fashion until someone in your family gets diagnosed. So back to your earlier statement, Brian, early detection. If you start feeling your legs being weak, you start feeling your jaws hurting and not working right, and some movement hindrances, please get checked out by your neurologist, because it's very important. There's so many different symptoms that come with MS that you can dismiss a headache, you can dismiss mobility problems by arthritis, et cetera, et cetera. And a lot of times it can turn out to be MS, and there is some medication and physical therapy that do this. But the MS Society and charity it's on every single city there. And I know by Pete Toro, I've ridden the City to Shore ride up there in New Jersey. It goes 100 miles out from Jersey to Atlantic City, day one, and 100 miles back. But there's different levels of cycling, different mileage you can do and participate across your location. So they're everywhere. That runs year round. We just had one here in North Carolina a couple weeks ago that I participated in. So a very well-known charity, and it is a 501(c), so you do get your tax deductions when you do your things. And you'll see when I do my presentation as well. I always look to do supporting charities like this that raise money for donations. So sometimes you may see emails. I'm sure you've gotten them over the last couple of days from me. Another one that I'm doing around, I'll present on that one later. But the MS Society is extremely important to me. And I didn't present on that one, but I knew it was there. I have so many to choose from, but the MS Society is definitely one. If you have a chance to ride a bike, you like to ride a bike, get out there and participate if you can.
Yeah, the links are there. And again, I'll post the links at the end of the talk, so they'll be in the chat for anybody to click on them. And thank you again. And Richard, this is also part of the matching funds program of VMware Foundation, right? So if they go into the foundation page, they can submit a check, and the foundation will match it, double or triple it, right?
Just make sure with any of the stuff that if you get a team member or someone that's doing MS bike or any other charity ride like Swim Across America, et cetera, that when you go into our site to do the matching and you put a designation in there, put the link to their fundraising page. It takes 3 months, believe it or not, 90 days for our foundation teams to get that money out to the foundation, and that foundation to process it to the right designee. So don't think if you don't see it come up in your account, get into it early if you can, but it will eventually show up. Mine showed up. I had a couple employees do a match on mine, and it showed up 6 months later. So just having to chase it process. Wow. Yeah, it's not an easy one. And according to our foundation team, they say it's really up to the charity if they really want to follow through the designee, right? So when you do the foundation, unless like you have the LaRose Foundation, it's direct to you, and you go through other third parties, it's a little bit more difficult. But if it's a direct foundational match, it's not a problem.
And what I've done with the American Cancer Society, when I was doing Real Men Wear Pink, I let the state know, hey, there's a matching fund come in, please match that to my fundraising effort. And I sent some emails to the appropriate people, and they were able to track it down, Rich. It did take several weeks, but they were able to track it down and then tag it so that my fundraising thermometer went up by the appropriate amount. So it is hard to do, but you should do it. Excellent. Next, I'd like to hand it over to Santosh. Santosh sent me this slide. I'm going to let Santosh talk to his charity.
Oh, okay, thanks, Brian. Thanks, Kurt. This is very good initiative. So, Kurt, we had a call a few hours back, and he asked me to put something. So, I am associated with multiple NGOs actively participating. These are the three top ones currently actively doing it. One is eVidyaloka, Parikrama Foundation, and Youth for Seva. This year, I have donated my part to Youth for Seva. So these all three are listed in Bright Funds. So I'm my part of this NGOs is actively working. That is my first priority. And whenever I get opportunity, I try to donate to these NGOs. This is the example. Currently, I'm actively working with all three, but most of the time spending with eVidyaloka. So this for last 5 years or so, I've been associated with eVidyaloka, Parikrama mostly 10 years, and Youth for Seva a couple of years. So eVidyaloka is good for me because I can be associated with eVidyaloka through my this Google Meet. So I can be at home, and these kids is at one of the remote village, and my strategy is to educate them on STEM, science, technology, engineering, and mathematics. This is example of this science competition that is held at India level, the country level. So there are two sets of team picked. One is the rural team and one is the urban team. In round one, they select a few urban team and few rural team, and they combine one urban team and one rural team. So uh, for last 2 years, our team has been winning this competition. So this is the last year I got this to mentor two girls, Puspa Kumari and Anu Kumari. They are on top. They partnered with two students in Bangalore. They were in good school, NPS Bangalore, and they won the prize. So this is what I do actively, mostly working with the. So my passion is to uh, get involved as much as possible and contribute my effort to bridge the education gap or knowledge gap in India. That is my humble that I want to do.
Very nice.
Thank you, Santosh. So again, just a reminder, Santosh says all of these are available through VM Foundation. Go into the foundation, you can type in the names, and you will find them, and then they will match the donations should you want to do that.
Yeah, all three are listed in Bright Funds.
Bright Funds, right.
Yeah.
Good. Thank you, Santosh. Anything else from you?
I'm good. Thanks, Brian. Thanks, Kurt. This is very good initiative. I love all you contribute to the cause. It's very, very noble cause.
So glad that you could. Let's go back to Richard again for Swim Across America.
All right, guys. Hey, thanks again, Brian, for doing this. Thank you, Kurt, for allowing us the platform to voice this. It's an amazing thing with VMware and the foundation and Bright Funds. I've never been to a company. I mean, Dimension Data Entity, my partner, is very philanthropic, but it's nowhere near the level of VMware, and I hope we can continue to pass through moving on in the future. So I do a thing. I have so many charities I work through on an annual basis, and when Brian approached this, I want to say, what's the important ones to me at the moment that may not be duplicated internally? And as a lot of you may or may not know, I'm an athletic person. I do a lot of athletic sporting with biking, cycling, swimming, running, etc. So I like to support some of these charities that give me a little bit of a boost to get my health up and continue my athleticism throughout the year. But at the same time, being able to raise awareness and money for specific causes, and some that are near and dear to me. Like Brian, and I think a lot of people advocate the same. You know, cancer is an important very important subject to a lot of us. It's one of the nastiest diseases out there in the world today. It's one of the ones I think a lot of the governments turn a blind eye to half the time. They should be funding a lot more to find some more research into this. And if we can come up with COVID vaccines as quickly as we've done, in my opinion, is we can find more cures for cancer in a much neater time and what the money provided. But that's just me on my soundbox, so apologies. With Swim Across America, it's much like the American Cancer Society and others. You know, we raise money to raise awareness and to advance some of the medicines that are out there and available today for patients with cancer and what they're looking for. The Swim Across America organization specifically will provide monies and funds to families that are going through treatment and that need to have some additional advanced treatments done that maybe insurance companies don't provide or will afford to. So this organization will help these families in the area that they're holding the event. All monies that they raise in the area will go 100% to that city or that city area. Right. So in my example, my charity swim is actually next Sunday. It's coming up, so this is perfect timing. Where I've pledged that I'll swim 2 miles. And that's a long way for those. It's 3,600 yards if you're not familiar. So if you want to walk 3,600 yards, try to swim that. It's 2 miles. It's not an easy thing to do. But this has been affecting me for the last 15 years. Cancer. It's a nasty thing. Including my own mother, as of 6 years ago, was diagnosed with breast cancer. It's the only person ever in my family history that has ever been diagnosed with any kind of cancer, and she caught it just by happenings of a mammogram. And thankfully, she got it done and didn't ignore her annual testing. And they found it, and unfortunately, she lost a portion of her breast at the time, but she's alive and she's kicking well, and she just got a clean bill of health 3 months ago. So right now we're okay and trekking and crossing our fingers, but I've lost well over 15 friends and family members on the other side, my wife's side of the family, to cancer in the last 15 years, including our good friend Joe Ruggiero. God bless his heart. It's a hard one to hit. I've been doing this swim in his name for the last 3 years. Anyone who donates, I try to ask if you have a person, a family member, a friend that you want me to put their name down. When I get to the event, I write all the names down on flags, and we post the flags throughout the entire event, so people are aware. We're supporting certain people and who we're wearing our heart on our sleeves for that day. I've got a really close friend of mine right now who's been battling end-stage cancer for the last 3 years, and I think her use case is quite interesting and uplifting because she's had breast cancer and it's gone, but she's got some lymphoma now happening. It's in her pancreas, in her liver, her kidneys, etc. She's got over 25 tumors around her body. And she has not taken any kind of cancer treatment outside of hormone therapy. So there is alternative treatments, just because the cancer treatment would have killed her. But she has been going on strong for 3 years, and she has become more athletic than anything else to keep it away. And it's proven that athletics will help fight some of these cancers and keep them down in progressing, including the fact that she's done now 2 half Ironmans with me over the last 2 years. So an incredible person. And I do a lot of this for her and to help raise some of the advanced treatments because they help pay for some of her hormone therapy as we move on. So coming up this Sunday, I'll be doing that. I've got links here to the donations if you want to match through Bright Funds as well. It's fantastic, but this is something that affects everybody. Cancer is there. This organization's in every single city out there. It's in Chicago. It's in New York. It's in New Jersey. So take a look at the organization. If you want a chance, swim a half mile, maybe swim a mile, get to learn to swim. It's in open water. Sometimes I do it in pools. Last year we had a hurricane here, so we had to do it in a pool. It sucked, but most of us trained for this, for pretty much the year just to go through this. So check out the organization. It's a phenomenal one. They do a lot for your community. So thank you for the soundboard here to promote this one.
And thank you, Richard. We had a name on your flag 3 years ago, and you'll have another one on there this year. So thank you so much.
Thank you, sir. I appreciate it. My other one that I do, and this is not a Debbie Downer one, I consider a bit more uplifting, as per Brian and his wife, and a lot of us as well at Santos. I see it with yours. A lot of us are about education, right? Giving to those who can't afford education or who are fighting for education. I come from a city. I didn't have a good education. We didn't have a lot of funds for books. I mean, I was one of those kids. We've had like 8 books in our house, and my mom loved to read. So we'd always go to donation centers to get books, et cetera, et cetera. But Donors Choose an organization that allows you to go, when it's in Bright Funds as well. You can go take a look at them. But if you go to the Donors Choose website, they're in every single community, every single city around the world, or around the U.S. at least. I can't even tell if it's around the world. I haven't looked around the world, but you can look up certain schools or projects or teachers. I have a good friend of mine, or a set of friends of mine, who are teachers here in the Charlotte Mecklenburg Public Schools, and they don't get budget to do shit, excuse my language, in any classroom. They get a limited budget to where they can teach kids based on a very peculiar curriculum, and it doesn't allow them to expand their thoughts. And one of my good friends is a teacher in a STEM course, which is science, technology, mathematics, etc. And they don't get anything. They get no iPads. They get limited technology. I think it's one computer for every 5 kids, et cetera. So she puts projects together and puts them up on Donors Choose. And a lot of us come in and we'll fund that project. And 100% of the money goes to that project. In fact, Donors Choose will go through and purchase and procure all the equipment they put a bill of material in there for that they want, and they will ship them directly into the teacher. Over the last 3 years, I've been supporting one of my STEM teachers. She gets me an update every month on what they're doing for new science projects, new technology projects. She's doing some coding now for young ones. Her classroom's 8 to 10-year-olds, so she's teaching them how early entry coding today. And they're starting to, believe it or not, there's some curriculum she's found out there for AI already. So she's already been looking at that and hitting me up on some bill of materials and things she wants to help with support her classroom. But, support your community education. These kids are our future. If the government and communities aren't going to support, at least you can, take what you've learned and given the good grace that we've been given to be working at such a great company and donate to this charity if you can. Thanks, Brian, for that.
Great idea, Richard. I appreciate it very much. Anybody have any questions for Richard on either one of these wonderful charities? Any comments? Nope. All right. And now our esteemed leader who sent me slides. And Kurt, thank you for your leadership in letting us have this sort of roundtable. And thank you for your slides. So over to you, Kurt, for building a better Punjab.
Yeah. So first of all, everybody who I was actually hearing was actually, it's very inspiring. It actually gives you goosebumps. It actually says, you know what? There's life outside work. And this is when I would say we all feel good about it. Exactly what Brian said initially. In times of stress, giving is one of a great de-stressors. And I personally felt it. And I've been actually doing it for quite some time. So why don't actually, before we go any further, let me just tell you what this is. I actually grew up in the state of Punjab. That's where a lot of us are from, like Monty and everybody. These are like, this is a very, very prosperous state at one time, but they became very rich due to like their lands actually getting high up in value. So a lot of drugs came into this part of the world. And because of that, that entire population started going down. So our charter, I'm actually teaming with so I'm an advisory council for this charity. And one of the things that we are doing in this one is, how do we make the state better? Okay, and that state is called Punjab. What you're seeing right now is basically what we are doing is there's 12,000 villages in that state of Punjab, and we are asking everybody like the donors and all this stuff to own a state. To own one of the villages in that state. And once they own that, we own like we've got the background in the end to actually help clean up the state, give like sports stuff to like some of the kids, provide education to many young girls, and also to provide self-sustainability for that very family or that village. So let's go on to the next one. Next slide. So there's multiple things we're doing. Think about it this way. India is a land of 1.3 billion people, right? And we cannot get anybody to even come in the soccer world because we don't have that resources. Tennis, soccer, basketball, football. If we give them access to these things, you'll actually see these people come up. So one of the things that we have started is, as soon as a child is born in that entire state, we are giving them a soccer ball to them to actually play with. We're giving them fields that they can actually go and play soccer. If people who are interested in actually like for example, tennis, we're giving them rackets and we're giving them all the equipment that they can actually use. This program started around like 4 or 5 years ago. And the beauty about this one is, and I'm taking sports as an example, that how this foundation is helping. the beauty about this one is, in last 5 years, we've already seen 2 sportswomen coming up in the ATP ranking in tennis who are going to be in one of the top 5 in the world in next 3 years. So that's one we are helping. I mean, otherwise, had we not actually got them to play or to encourage them and get the right coaching, they would not have reached that. Second is learn. Learn means how can we actually train you guys from early on. So we've got mentors across that state where we are actually helping like education. Okay, we are educating the parents first that why education is important for the kids, and then helping the kids go through those education. And if we keep them busy going to school, play soccer, come back, do the homework, in the evening we actually have evening activities, guess what? Drugs are going to be eradicated right there, right? And then obviously helping the women in the families so that they can actually help their families come up to the next level. In other words, we are finding work for them within that own society. So this is something that, so there are multiple things that we are doing in that state to actually help this state come up to the next level. Let's go to the next slide. And I mean, there are stats which we are actually building right now. And one of the things is like we are teaching them basic waste management. How do you actually leverage that waste? How do you actually do, like, how do you use the compost, right? What's female hygiene? Educating them on that, right? How do we actually get you guys educated on multiple stuff? So we have actually partnered with Seattle out here, and we are actually getting those the students from Punjab to Seattle University, where Seattle University has said, we are going to take in at least 15 students every year to actually come in so that we can actually give them free education. So imagine 15 students coming every year, right? That is just one part of the world. Then now we're going to San Francisco. So we are opening up chapters of this Round Glass Foundation. And this is all around one very simple thing. How can we better the lives? And each one is actually helping us go to the next level and saying, hey, you know what? These are live examples. That's what we are doing. And that's one of the things that we are actually helping the team. My wife is currently in India for 2 weeks, and she's spending 2 days of her time in visiting these villages, educating them out there, and helping them come up to the next level, and like working with the kids, staying in the village. So that's what she's doing on 6th and 7th. That's what she'll be doing. She'll be in those villages, living with them, talking to them in the evening, in the nights, and all this stuff. So that's something which is very near and dear to us that we can actually help and give back. Okay, next slide. And just FYI for you guys, this is the good part about this one is it helps me on the matching funds. It's a part of the Bright Funds, and we are very, very thankful that we can do this. The other charity, which is not mentioned out here, is also called Shankara Eye Foundation. So anytime there are older people who cannot get the cataract operation, you just put $30 and they can actually get that cataract operation.
Wow.
This I have started as like from I would say the year my son was born, both my boys were born. Every year we actually make sure that as a part of giving, we make sure that they actually give $30 from their birthday money into this. So now I'm training my kids to actually start giving back, right? So once again, I mean, everybody does every foundation, right? All of you guys are actually giving great stories. You're giving me inspiration to do more. And that's what our charter is, to actually keep on helping, because it's not only about it's not only about taking, but you get more joy in giving. And that's where I find maximum joy. And thanks everybody for sharing this. Brian, great initiative. And,
hey, Kurt,
and let's keep this up.
Would you be willing to share the link to that cataract surgery in the team chat? I'm going to post all of the links, okay? So they'll all be there. Here's all the links in one place. I'll have to find links for Santosh's from the foundation, but I want to put all the links out there. I want to put it into the chat. I want to put it into the recording so that as we share this recording with others within the company, if people choose to go donate to any of these beautiful charities, they'll be able to go do that. So, so that's that. Here's the cool part. As a thank you to all my friends who collaborated with me today, I'm going to be making a donation personally to every single charity that was mentioned on the call today. And I'm going to do it through the foundation if possible. So the VMware is going to either double it or triple it depending upon that. And I'm going to do that in your name. So thank you for collaborating with me in this effort. And I'm going to ask anyone else who wants to give, look at the chat that will be posted here in the Teams link, and you could click the links right there, or obviously go through VMware Foundation to make a donation.
And this, if anybody else would like to share anything that they would like to talk about
absolutely.
the charity, we would love to actually hear about that.
This is a great time to do that. Yes, absolutely.
I know all of you guys do some sort of work or something like that. So anyway, once again, Brian, this was great initiative. Let's keep this thing up, right? Let's see how the Broadcom thing actually pans out. Regardless, we are all human beings. You know, being human is one of the most important things, which I always tell everybody in my life. Hey, there is one side is work, and the other side is, you know what? There's life outside work. And this is life outside work for us. So let's keep on actually giving. I think this gives us a lot of joy. And it's not about my foundation or Brian's foundation or like Santosh's or Richard's or JP's, anybody's foundation. It is just about the joy you get and how you raise the level of other families, whether it's through actually early screening, whether it's through education, whatever it is. It's all about, you know what, how can we help others? So that's one of the reasons which I've actually loved. I was at Microsoft, they would also match and they would actually have goals. VMware does the same thing. And believe me, I have leveraged every penny that VMware gives. Even in my 12th anniversary, I got like over $3,000 given to me by VMware to give to some a charity. And I leverage every penny out of that one too. So, you know, this, I believe, is a great initiative that Betsy has actually run. And I'm super excited that we are a part of it. And we have a chance to actually keep on giving more and more. So thanks to VMware, thanks to you guys. I see the passion in all of you guys, and it's wonderful to actually see how everybody is actually contributing in uplifting the societies that we have around us, for us, and which is near and dear to us.
Beautiful. Beautiful. I can't add anything to that, Kurt. I can't add anything at all. You nailed it. So thank you, everybody, for attention. Go ahead, Rich.
Yep. I was going to say, you know, just for everybody that didn't get a chance to present and anyone else who supports other charities, please share. Don't feel ashamed to send me a link to help support one of your charities that you're doing something for, et cetera. I mean, I welcome all of that. I'm a big advocate of philanthropy. So please send it my way. Don't be afraid to send it to any emails to me. If you want my home email address, I'll give it to you. So I'm wide open.
Or use the team chat and just pile on what we've already got going here. That makes it easy for everybody to see those asks, Rich. So very good. Well, thank you, everybody. We've been given so much. Let's give back, and thank you again for your attention to and giving me an hour out of your day, giving us an hour out of our day to think about things that are, you know, really important outside of work. As Kurt said, this is life. So thank you. With that,
thanks, guys.
Close the call.
Yep, great call, guys. Thank you.
Thank you, everybody.
Guys. Thank you.